We're asking foot and ankle surgeon, Mr Andy Goldberg, who's well known in northwest London, a question about treatment options available for people who are suffering with ankle arthritis from wear and tear. Andy, we'd be keen to hear about treatment options available for these type of patients.
Thanks for the warm introduction, Steve. Now, as you know, ankle arthritis can be a debilitating disease that can cause pain and stiffness and affect the quality of life as much as end-stage hip arthritis and heart failure. The commonest cause of ankle arthritis is a nasty break or severe multiple sprains of the ankle, which means the patients are often much younger than those with hip or knee arthritis. The good news, as you say, is that most ankle arthritis can be treated non-operatively. Ankle supports can be excellent, painkillers, and importantly, physiotherapy to strengthen up and focus on the patient's core. That improves their function. Now, sometimes we do add occasional joint injection, and that helps both diagnose but also to settle down the inflammation. And although it doesn't cure the arthritis, it can buy the patient's time. And when all of the non-operative treatments have been tried and failed, then we're left with two main surgical options. And those are ankle fusion and ankle replacement. One stiffens the joint so there's no motion, and the other returning motion, so they're really very different treatments, and it's hard for patients to decide which is better for them. Now, in an ankle fusion, we remove the cartilage and we put screws across the ankle so there's no motion at all. And it's important to bear in mind that the foot has 30 joints, so even after an ankle fusion, if the other joints are healthy, then the patients can still have a lovely range of motion and can walk without a limp. There are, of course, some downsides, because all of the stresses now have to happen in the surrounding joints, which are then put under more pressure and more stress, and they can wear with time. And we know that 100% of patients will have some X-ray evidence of wear and tear arthritis 10 years after an ankle fusion. Now, not all will require treatment, but it is an important issue. An ankle replacement, on the other hand, is where we resurface the damaged ends of the joints in order to provide gliding motion that aims to protect the adjacent joints. There is a downside to an ankle replacement, though, because it's mechanical, and just like hip or knee replacements, they can fail with time and may require revision. And hence, we tend to really offer them to patients over the age of 50 these days. The main headline message, though, for your readers to take away, is that both an ankle replacement and an ankle fusion are excellent operations, reducing pain, restoring function, and it can improve the quality of life of the patients that we treat. The most important variable, though, when you're assessing a patient with ankle arthritis is the state of the surrounding joints. Strangely enough, that includes the hip joints. So if your patient has stiff hips or stiffness or deformity of their foot and ankle, we now know from large randomized control studies that those patients may do better from an ankle replacement than they will from an ankle fusion. I hope that's helpful. And as always, I'm happy to discuss any specific questions.